And the theme of my presentation is non-invasive approaches to facial contouring in agents. As to contouring, both we and our patients are familiar with body contouring. And we have several methods to achieve body contouring non-invasively, such as cryolipolysis and hyperthermic laser lipolysis. However, as we have experienced, merely reducing unnecessary volume with this method is not enough to get satisfactory result. What we need to add to achieve high patient satisfaction is skin tightening. It's because when we focus solely on reducing unnecessary volume, the skin may sag and preventing us from achieving the ideal body line. What I want to emphasize is that we need to use multi-aspected approach to perform contouring effectively. Keep this in mind. Let's consider what facial contouring is. Is it enough to achieve ideal results by performing volume reduction and skin tightening on the face as the same as the body? Based on my clinical experiences, the answer is no. This is because our eyes have characteristics of perceiving darker areas as indentations and brighter areas as protrusions. It means that uneven skin tone can negatively affect the results of facial contouring. For this reason, we have to add color correction as a factor in a facial contouring, in addition to volume reduction and skin tightening, especially in Asians. We are very sensitive to the color change, as you know. Now, considering the three factors to contour the face one by one. Regarding volume reduction, our aim is making negative vertical change like this. So it's essential to target the retaining ligaments and subcutaneous connective tissue. We have several methods or alternatives to achieve this, but we choose to use sequential monopolar and bipolar pulse radio frequency to deliver bulk heat to deeper tissue. I'll show you why. To evaluate the efficacy of sequential monopolar bipolar pulse radio frequency, whether it could make negative vertical change, we conducted a clinical study. For 15 subjects, we performed a single session of SMBPRF in a low-energy, march pulse manner to cover full face and submental area. The average shot count to cover the area was 500. And to assess the efficacy, we used 3D images constructed from clinical photographs with the specific system. Vertical changes are recorded as a local height differences from the baseline. As a result, the average negative vertical change was 0.83 plus minus 0.44 millimeter. It means reduction in height. There was statistical significance between the measurements taken before and after the treatment. As you can see, obvious effect was seen in the lower face and around the malignant lines, as indicated in the right figure. Orange and yellow indicate the negative change in height between before and after the treatment. Based on these results, we believe that using sequential monopolar and bipolar pulse radio frequency is suitable to make negative vertical change or volume reduction. The next point is skin tightening. It can be achieved by using high-intensity, high-frequency power ultrasound beam, because it can selectively deliver a large amount of heat to dermal tissue selectively. Besides, it can induce skin tightening with directivity. Let's see more close. As you know, our skin has been exposed to strong tension due to our facial muscle contraction. And the direction of skin tension has been identified area by area. Based on that, some useful markings like as relaxed skin tension lines and longer lines are developed. According to these features of skin, we can hypothesize that the effect of the skin tightening would be maximized if we could add the directivity to skin tightening that is perpendicular to the relaxed skin tension lines. Based on this hypothesis, we developed a specific method to apply heat energy into the dermis with parallel ultrasound beam. Since the device can deliver 7 heat column, heat area in a dermal area only, we can create thread-like heat area if we continuously bond the columnar heat area one after another without gap. We named it thermal thread technique and evaluated the efficacy. In a clinical study, the thermal thread technique has been proven to induce vectorized skin tightening, as illustrated in this figure. In this case, we created the thermal thread parallel to the line that starts from the oral commissure to the external auditory canal. The skin was tightened along the thermal thread, as you can see. The average of tightening distance was 1.91 plus minus 0.61 millimeter, and it lasted 6 months. These are reasons why we believe it's suitable for skin tightening. So, the final point, color correction. We think that a fractionated 755 nanometer picosecond Alexander laser is one of the ideal alternatives. This is because the fractionated picosecond Alexander laser has been proven to induce efficacious pigment removal and skin rejuvenation non-invasively, as demonstrated in this case. We have used 755 nanometer picosecond laser for pigment removal and skin rejuvenation for the past 8 years. And we conducted a retrospective study to analyze 786 cases who have treated with 755 nanometer picosecond laser in our facility alone. The result shows that it's safe and efficacious to improve skin tone with minimum side effects. Of course, we can also use a full beam, not a fractionated beam, but when we use full beam with high frequency, the PIH may occur, and the scab or a microcrust would be occur, and we need to time to wait up to 7 days to falling off. If we use low intensity, many sessions are needed to clear the pigments. That's why we use a fractionated beam as a way of color correction for a part of non-invasive facial controlling. With these 3 methods, we believe we can perform facial controlling. Let me show you a representative case with this method. This case is a 71-year-old female, and it's okay. As you can see, she is a good candidate of facial contouring because she got extra volume on the lower face, loosened skin on the full face, and color unevenness. So, as the first phase, using sequential monopole and bipolar RF to lower the face, and the second phase, using high-intensity, high-frequency parallel ultrasound beam with thermal thread for vectorized skin tightening on full face, including some mental area. And lastly, using fractionated 755 nanometer picosecond Alexander laser to cover full face as a color correction. These are no severe downtime that affect their daily life. This is a very good point. And this is a representative case of non-invasive facial contouring with our method. It involves causing negative vertical change in the lower face. This contour line is very good, and vectorized skin tightening perpendicular to the relaxed skin tension lines, and color correction on full face. I believe this is a very good result, considering it's achieved through non-invasive approaches. Of course.
Excuse me, this result after how many time? After how long?
One treatment.
After how many?
After 4 weeks.
4 weeks,
After
yes.
4 weeks, yes.
Because collagen induction takes maybe 1 to 2 months to rebuild new collagen injection.
Yes. Of course, I agree with you, but after the 8 weeks and 12 weeks, she got a very good improvement.
Yeah, much better, yes.
Yes, much better. Thank you.
Okay.
Let me cover what I have covered. Facial contouring is not just about reducing unnecessary volume in the face, of course, including reducing unnecessary volume, but skin tightening and color correction at the same time. And although there are devices proven to be effective for achieving a single effect, combining specific energy-based devices is important to maximize the clinical results and achieve satisfactory facial contouring non-invasively. This is a very good point, non-invasively. And understanding the specificity of each device is necessary to determine the appropriate area, depth, and a target for treatment and develop a new treatment strategy for facial contouring. Thank you for your kind attention.